Hello, everyone. I'd like to welcome you to our session today on the Canadian Disability Benefit Landscape. Before we begin today's session, I would like to acknowledge that the city I'm joining you from in Gatineau is the unceded traditional territory of the Algonquin Anishinaabe people. I recognize, honor their deep connection to this land, as well as the lands where each of you are joining from. The map you see here reflects the many Indigenous nations whose territories span across what we now know and call Canada. We honor them all, past and present, and commit ourselves to learning from and respecting their histories and cultures. The Pathway to Benefits project is a free national initiative led by Mood Disorders Society of Canada to help Canadians with disabilities and their families access the financial supports they are entitled to, but too often miss out on. Pathway to Benefits is funded by the Government of Canada's Disability Benefits Navigation Program. The views expressed here today do not necessarily represent the views of the Government of Canada. So briefly, introductions. My name is Diana Vince. I'm the National Program Manager at Mood Disorder Society of Canada, and I will allow my two colleagues to present themselves. We'll go over to Sherry.
So sorry about that. Hi, everyone. My name is Sherry Mayer. I'm the National Outreach Navigation Coordinator for the project. I'll pass it over to Ashley.
Hi, everyone. I'm Ashley, and I am the National Benefit Navigator here at Pathway to Benefits. If you end up calling in having more questions, I am most likely the person that you will get to answer your questions.
All right, so before we get started, please note that your microphones are muted and the session is being recorded. We invite you to use the Q&A function to submit any questions you may have, and we'll address them towards the end of the session, actually towards midway of the session even. I encourage you to, raise your hand and ask live questions as well, and we'll be addressing those. Please do not disclose any personal health information when asking questions. The chat function is disabled. However, there are going to be some links that will be shared via the chat, so keep an eye out for that. And a recording of this session will be shared with all registrants following the session with a follow-up email. But you will also be able to find on our website via the link you see before you that I'm going to share in the chat as well, all of our previous sessions that took place. If you'd like to watch them again, all the recordings are located there. So the agenda for today, for those of you that are joining us and you're new, we're going to briefly go over who is Mood Disorder Society of Canada, what is the Pathway to Benefits program, and we will be going over the Canada Disability Benefit, the CPP, as well as provincial disability programming. So briefly, Mood Disorder Society of Canada is a national non-for-profit organization dedicated to improve the quality of life for people affected by mental health issues through advocacy, education, and support. We provide education and awareness about mood disorders to the public, healthcare professionals, and policymakers. We offer support and resources for individuals living with mood disorders and their families, and we also advocate for improved mental health services and policies across Canada, all by promoting research and innovation related to mood disorders. I will now hand it over to my colleague Sherry that will go over what the Pathway to Benefits program is all about.
Thank you, Diane. What is the Pathway to Benefits? Well, a national initiative, as Diana alluded to, through the Mood Disorder Society of Canada, supports Canadians with disabilities and their families by applying for the Disability Tax Credit, the Canada Disability Benefit, other provincial and territorial supports. And the program is free, inclusive, and person-centered. Our services are offered through one-to-one navigation support, which Ashley so kindly offers, personalized help in completing applications. We have an online resource hub, easy-to-use digital tools. We centralize all of our information, making it very easy for you to find on our website. We have peer and trained volunteers that help support the project across Canada. We're culturally informed, empathetic, and we support all people who come through and apply. We work hard at organizational partnerships at helping extend our reach across the country. We have several tools and training opportunities to assist local organizations in understanding what we do. And a lot of our outreach is toward underserved communities for people who are seeking assistance to apply for these benefits.
Alrighty, so we're going to get started on the content here. The first thing that we're going to talk about is what are disability benefits. Disability benefits are financial and other support programs provided by the government on any level to help individuals who are unable to work or face barriers due to a disability. These benefits aim to provide support, cover medical and living expenses, offer access to healthcare, housing, and employment services, and promote independence and inclusion. Whoa. We're having a little bit of technical difficulties here. There we go. There are multiple different types of disability benefits depending on the level of government that is providing them. The most common level of government is federal disability benefits. These will have to do with direct payments, such as the Canadian Disability Benefit, the CPP disability, employment insurance sickness benefits for temporary disability, and also reducing tax and increasing savings in the disability tax credit, which reduces income tax for eligible people, and the registered disability savings plan, which is a long-term savings plan, which includes grants and other funding to essentially double up to a certain amount of your savings if you have the disability tax credit. Come on. We are having a little bit of a technical issue with our slides right now, but
There's
we
a little
will
bit of a
keep
delay.
going.
Usually there's a little bit of a delay when you'll hit it. You have to just give it a moment. Yeah.
And the next level that we're going to be talking about is the provincial disability benefits. These vary by province. They can be from income supports, such as ODSP, AISH in Alberta, and PWD. That is all under provincial jurisdiction. So that means that if you want income support, that you need to contact your provincial government. And these programs can also include dental, healthcare, and housing. All of that will be under your provincial, with housing being dual with your municipal or city government. There we go. Here's a little summary of what is provided. So federal benefits are administered by the Government of Canada. They include, as I said before, CPP disability, EI sickness, the disability tax credit, and RDSP. They're based on medical criteria, and in the case of CPP, contributions. They provide monthly income, tax credits, and savings plans, and all of these you apply through your Service Canada, or you go into Service Canada to apply, and you can receive all of them. Whereas provincial benefits are in the jurisdiction of your individual provincial governments. If you're from Ontario, you'd look in Ontario. Alberta, you'd look in Alberta. BC, you'd look in BC. And we, of course, can help you regardless of the province or territory you're in. These are based on residency, your disability status, and financial need. And they provide income support, health, housing, and employment assistance. And in this case, you would apply through local provincial services offices in most provinces. And you can supplement with federal benefits such as the Canadian Disability Benefit. Can I please have the next slide? Thank you. And there are many reasons why you would apply for these fundings. This could be something as simple as accessing financial support to receive monthly income to cover your basic living expenses. You can maintain your health and well-being through applying for dental care or medication coverage, vision, and other health care, even if you don't need the monthly income. You can become more independent through having income and through other housing and other provincial benefits. And the DTC and RDSP also help you plan for the future to be able to build that future you're looking for. And it also helps to reduce barriers because you can get help with employment, you can get help with housing, and even transportation on the provincial level. Common eligibility criteria is that you're between 18 and 64 years old, you're a Canadian resident, and most of the time you'll have to have filed your most recent tax returns. Most of the time you have to have something severe and prolonged, except in the case of EI sickness. EI sickness, you can have a temporary disability to receive extra funding. Severe is defined as significantly restricting the ability to work or perform daily activities. Prolonged is often a year or more, or is indefinite for the case of a lot of disabilities. And it requires quote unquote certification from a qualified medical practitioner, which essentially is your doctor filling out forms. Program specific requirements can include having given money and contributed to CPP, and you can be unable to perform any work. The disability tax credit is that you just must meet the medical criteria. Provincial programs mean that you make under a certain threshold and you have financial need and you've been a resident of their province for a specified amount of time. Common application processes now. Federal programs, you are able to mail in your forms to a given tax center dependent on your province, or you're able to submit it online through your Service Canada portal, or in the case of the disability tax credit, it can be done through the Canada Revenue Agency, CRA portal. You will also need a medical certification. So in most cases, they have a specific form they need your doctor to fill out. And you will also need to submit supporting documents in some cases, such as your proof of identity, some medical records, and employment history. This is mostly if you get denied, and we also provide help with appeals. So if you do need to submit these supporting documents, we are able to help guide you a little bit through this process, as normally this is through an appeal after your first application. And then you will have to wait for review. Processing times vary based on the benefit you're asking for. The Canada Disability Benefit is one of the faster ones if you have the disability tax credit, and then CPP, for example, can take up to 3 to 6 months. And as I said before, if you are denied, you are able to appeal. We also offer help with appeals, so feel free to call us if you have an appeal and we can help you navigate that, which an appeal just means that you need to submit additional evidence or request a formal review. The most common application processes in Provincial includes initial intake appointments and financial eligibility screening. Some provinces require to see your bank statements, some just go off your taxes. It is very much province specific. And then you'll often have to fill out a disability determination package that is completed by both you and your doctor. Then you'll submit your application. Some provinces have it by phone, some have it online, some have it that you have to go in person. We can also help you navigate that based on your province, and then you'll receive a decision. Once again, the timeline depends on your province, and you'll also be able to appeal that if you get denied. Common documents you'll need to have is personal identification. You'll need your social insurance number, your government issued ID, and your proof of legal status in Canada, if applicable. Medical documentation, medical reports, or in the case of the DTC, a certificate from a licensed practitioner. Each province, each program has different rules on which doctors can fill out this information depending on disability. So it is very good to check whether or not your doctor can certify if they are not a general practitioner. Often they'll ask for a diagnosis or prognosis of disability, focusing on the impact that it has on your life, the functional limitations on daily life or ability to work, treatment plans and test results, work history, record of employment, recent notice of assessment, and direct deposit information. These are all the documents you should have applying. And financial information, how many assets you have, expense details, who your legal representation is if you choose to have legal representation. Most people decide to have legal representation once they need to appeal, or if you have a power of attorney that can talk on your behalf. This is also something that you may need. We're finally at the FAQ. Do mental health conditions qualify for disability? Yes, mental health conditions do qualify for disability as long as they meet the requirements for the program you're applying to. Most automatically have mental health conditions in their list, but often if they don't, they still qualify as it can be considered a severe and prolonged disability. I do not have access to a family doctor. What do I do? There are many options of who to go to. First of all, if you happen to not have a family doctor, but you've been referred to another health professional, you are able to have them fill it out in most cases because they are tied to your impairment. And then also you are able to go to a walk-in clinic, and if they are unable to do it, they will refer you to somebody who is able to. Lastly, there are also online options. So there are different OHIP, for example, or provincial program covered walk-in clinics and doctors that will help you fill it out, or if not, they will be able to help you navigate. These can include TELUS Health and other online doctors that can easily be found on Google. Does it cost money to apply? This is a big one. There should never be a cost for you applying to benefits for you. The only cost you should have is if you retain legal representation for an appeal. If you choose not to go through a legal clinic or another free form of representation. The government will never ask you for money over email, text, phone, etc., even if you're applying. This is a completely free process, and we are a completely free navigation service as well. How do I start? What do I start with? This is a common question. And really, I often tell people that it depends on what your goals are. If, for example, you are somebody working, you have different needs than somebody who needs ODSP or another provincial income supplement as fast as possible. It's very much a determinative and personalized process. However, I often recommend starting with the disability tax credit and the Canada Disability Benefit. These are both programs that give you the most control over what you can do. And however, if you are in a situation where you have no other benefits and you do need that income support, the best case scenario to start with is your provincial plan and your provincial income supplement. So basically that is to say, feel free to call us and we can give a personalized roadmap. Or you can look through everything on our website, benefitspathway.ca. We have information about all the benefits that we can find. We have guides and other information that may be able to help guide you. And even if the website doesn't have everything you need, we also have our phone number that you're able to call us or text us. And our email is also on the website as well. So all our information is there and you're able to help yourself, or if you need more guidance, our volunteers and myself are here to help you. And now we are at the Q&A portion of our session today. Can't wait to hear everybody's questions. Feel free to use the Q&A or raise your hand to ask any questions, and either Diana or Sherry, my colleagues, will be reading them out loud so I can answer.
We have a quiet group today. That just means that your presentation was so much very comprehensive, I can say. But in case we do not have any questions. Oh, there we have something. Sherry, take it
We
away.
have one. Sherry, take it.
Do you offer services in Quebec? From Harold.
Yes, we do. We offer services in English and French. We have another benefit navigator who currently is helping out with French as I am learning, but honestly, they're amazing and we can answer in either language. But yes, we do offer services in Quebec. We offer it in every province and territory.
And anybody that contacts us, you can feel free to contact us, any of the two official languages.
Yes.
We're more than happy. Some of our volunteers as well are Francophone speaking, so we definitely are able to respond in both languages.
Yes. My lovely colleague, Aimee, who is actually in this webinar, is amazing, and she answers a lot of our Francophone questions.
Harold follows up with, can you please provide the contact information, or is it on the website?
Oh, we'll be throwing that into the chat, Harold, in about one moment. It is on the website as well, and you can find it. I just included everything. So we have our email details, our 1-888 number, as well as our webpage. And our webpage, I invite people to surf around because there's a lot of little resources, guides that
Yes.
we're developing. We even have some wonderful mental health resources that you can that are downloadable, free of cost. But most exciting about that website is really the capacity for you to reach out to our team, and would be more than happy to answer. No question is too big or too small. So.
Nope. And there are no bad questions.
Okay, we have one from Bala. What are your contact timings so that we know when to call? Please mention if they are Eastern time zone only. Please mention holiday list. And is the contact line closed for the weekend?
You are able to call, email, or text us at any time. We have our voicemail open, and often they will get responded to within one business day, or if it's very busy, 2 business days, but we strive for 1 business day. Our live phone call, chat, etc., is open from 9 a.m. to 5:30 p.m. Eastern time. But it does not matter what time zone you're in. Just feel free to leave us a text, chat, email, voicemail, and we will get back to you as soon as we can.
And we do encourage Bala, just to complete that. If you are to communicate with us or our team over the weekend, and not to worry, the following business day would be more than happy
Yes.
to reach back to everybody. So feel free to leave us all the voicemails, and or even if it's just through email, don't be shy. Just because it's the weekend, we'll be addressing those at the next business day for sure. Okay.
We get back extremely quickly, even after a weekend. If you email on a weekend, often you'll get a reply on Monday. And most of the time, it is first thing Monday. Do not hesitate to contact us for anything.
Do not see any further questions. Does anybody have anything else that they'd like to mention? If it doesn't, we could have a shorter session, no problem. We usually like to leave it open to have thorough time for any discussion or any live questions that people would like to ask. I've taken the liberty, and I'd like to ask the group that is here to include in the chat a feedback survey. We love to hear what you think about our sessions. At our last session, we did have a little bit of an issue, but the feedback survey was sent with a follow-up email. But this time you have the link there in the chat. We'd love to hear what you think. It allows us to prepare for our upcoming sessions as well. So that would be wonderful if you can fill it up. I've also just included our next, oh, there we have another.
We have another question.
All right.
What type of volunteers do you require in Quebec from Harold?
Regarding the volunteers, Harold, it's basically we are looking when we were doing the hiring of the volunteers. A lot of our volunteers have lived experience, and of course, French speaking, and know a little bit about the ins and outs of the disability programs provincially, of course. So those are some of the requirements that we're looking at. So we have I think you're answering the one from Linda. Linda,
Yes.
just in short, even if you did miss the presentation, it is being recorded, and we'll be sharing a link within a couple of days with a follow-up email. So I encourage everybody to keep an eye out on your emails because we do love to follow up. We'll send you recordings. We'll send you the feedback survey again, so you'll have the opportunity in case you missed the link in the chat. And it always includes a registration link for our upcoming session. If you do go on our website, and I will share it again, there is an area on our website where you'll be able to find all the past session recordings. And I'll send that here to everybody in the chat. So you're able to, view past session recordings. Just give us a couple of days, of course, following a session like this. We do gather all the proper information and put it up there.
Feel free to also send off the webinars to anybody that might not have been able to come today. And of course, if you have any further questions that come to you a bunk in the middle of the night, for example, feel free to contact us at any time and we will be able to answer any questions you have and give you that personalized one-on-one support if you feel like you need it.
All right. So, well, I'd like to thank everybody who has taken the time in their most likely busy schedules to join us today. We greatly appreciate it. As mentioned before, a recording of the session will be shared with all registrants in roughly about a week or so. So keep an eye out for our follow-up emails and make sure to check your junk mail. Sometimes our emails tend to go there, so keep an eye out for that. Our next session, what doctors and patients need to know, medical practitioners' role in DTC applications, is taking place on November 24th. Again, 12 to 1 Eastern Standard Time. A feedback survey has been shared with you via the chat. Once again, I'd like to thank all of you for joining us today and thank my colleagues, Ashley and Sherry, for being with us today. Thanks, everyone. Have a wonderful afternoon.